Procedural Coding System. That is a full form of Hcpcs. Okay. Okay guys, it's not download properly, so I just show without a slideshow. So Hcpcs means Healthcare Common Procedural Coding System. In that, what is the usage of Hcpcs? By using of CPT codes, we are reporting the code for the service of the provider. That means for surgery, anesthesia, for a medicine, we have to apply the code from the appropriate chapter from CPT to reporting the service of the provider. But for ICD codes are used to report for disease condition of the patient. Now, Hcpcs codes are used to report supply codes. So, by using of Hcpcs, we are reporting the code for materials. What are the materials that are used in our service? For example, we are reporting the code for ECG machine, battery of pacemaker, syringes, cottons. So for that means for materials codes are used to report by using of this Hcpcs. So this Hcpcs code can be able to report for both Medicare and the Medicaid patient. We can able to report this code, Hcpcs code, material, cost of the material, cost of the syringe, cost of the medicine. Okay, for the cost of the material, we have to apply the code from Hcpcs. Then these codes are not present in our CPT book. We have a separate book. I think everybody know that this is a Hcpcs book. Am I right? Okay, yes, sorry. Hcpcs codes are level 2. Hcpcs codes are not present in our CPT book. That will present in a separate book. See that this is a Hcpcs book. This is a Hcpcs book. Hcpcs. Okay. Then level 2 modifier that are present in Hcpcs. Level 2 modifier that are present in Hcpcs. Level 2 modifier. That means CPT modifier that contain 2-digit numbers only. CPT modifiers that contain 2-digit numbers only. But Hcpcs modifiers are alphanumeric or alphabet. So for example, F1, F2, AA, QX. So like that, these modifiers are called as Hcpcs modifiers. Okay. So this is the book classification of Hcpcs. So the book has been classified. That means the codes are categorized from A to B based on the supplement. Okay. Based on the material, the codes are categorized from A to B. For example, A codes that are present in A code, transportation service are present in A codes, including ambulance, medical, surgical, supply codes that are present in the category of A. Internal parenteral therapy codes are present in B. Outpatient service, that means during outpatient, what are the materials are used? That type of codes are present in C. Then like that, based on that materials, the codes are categorized here. For example, 1 minute I show you. Here see that A for ambulance, A4 to 06204 for medical surgical supplies code, and A9 code section for administration code, B series code for parenteral therapy for the cost of the drug, like that. So these are the codes are classified as based on the materials. Now, example A002, A0999 for transportation service, A42002, A8200 for medical and surgical supplies. A4002, A8004 for medical and surgical supplies. A900000 to A9999 for administration code. Now we are going to discuss about this transportation service code. A002, A999. So these are the some of the example for transportation service. These are the some of the example for transportation service. A0021 for ambulance service. Ambulance service. So this code should applicable for Medicaid patient only. We can't able to report this code for Medicare patient. This code only for Medicaid patient. Medicaid means below poverty line people. After completion of this epic, I am going to take the billing. In that billing, I will explain you about what is the meaning of Medicare, Medicaid. So everything should explain at the session of billing. Now, so this code only for this code only for Medicaid patient should not apply the code for Medicare patient. And A0080 for non-emergency transportation service. That means, so the below code section for non-emergency, but the vehicle provided by volunteer. Example for individual or if any organization provide the vehicle to admit the patient in the hospital means go for A0080. So vehicle provided by volunteer, go for 80. Vehicle provided by individual, that means individual family members or a self or nearby neighbor means go for 90. So 100 for transportation of taxi, 10 for bus or intra or interstate carrier, 130 for wheelchair van, 130 for wheelchair van, 140 for air travel. According to the transportation service, here the code sections are classified here. So guys, in Hcpcs and billing there is no guidelines. All are direct coding. All are direct coding, no guidelines here. You just check the name of the material name and select the appropriate code in the Hcpcs group. That's it. Suppose if the drug is given means you have to check the unit of the drug and report the unit of the drug in our question paper, and you have to check the corresponding name of the drug, and based on the unit you have to apply the code. That's it. Okay. So in Hcpcs there is no guidelines here. All are direct coding. So don't worry about Hcpcs. And so A42062, A7501 code section for medical surgical supplies codes. Medical surgical supply code for injection infusion. For that material of infusion, injection, infusion, then for bag, that means urinary bag, or tracheostomy bag, osteotomy bag, or for syringes, for catheter, for battery, we have to apply the code here. Based on the material, the codes are arranged here from the code section of A42062 to A7501. Now, check that injection and infusion. So, injection infusion codes are present between A42062 to A4232. A4232. For A4206 for syringes. So, see here guys, this is the size of the syringes. According to the size of the syringes, here we have to select the appropriate code. Here we are reporting the code for cost of that syringe. We are reporting the code for the cost of the syringe. According to the size of the syringe, the codes are classified here. So for 1 cc or less, A4206 for each syringe, 07 for 2 cc, 08 for 3 cc, 09 for 5 cc, 10 for needle-free injection. So the previous code section for syringe with the needle and A4210 for needle-free injection. Needle-free injection. So for example, suppose if a doctor used 1 cc syringe, 5 numbers. That means number of syringes 5. The size of the syringe 1 cc. How can we report? Into 5. Super. A4206 into 5. Because the size of the syringe is 1 cc. Number of syringes 5. So we have to apply the code for each syringes. Am I right? We have to apply the code for each. Each means every syringe. So the number of syringes 5. So A4206 into 5. That's it. So here these are the code section for injection and infusion. And for administration code, we already discussed the same administration code in medicine section also. In medicine chapter also, they were explained about the administration code. Route of administration. These administration code only for Medicare patient. These administration code only for Medicare patient. So for influenza virus vaccine 08, G0008, 0009 for pneumococcal vaccine, then 10 for hepatitis B vaccine. Hepatitis B vaccine. So these are the code section for administration of Medicare patient. Please take a note, guys. Based on these 3 things, we have to select the appropriate code from that table. And why here we are reporting that code means for that cost of that drug. For that cost of that drug, we have to apply the code. So in our ICD also we have a table. That table to report the side effect or to report the condition of the drug. What is the problem is arising when a patient intake the drugs? When a patient take the drug, what are the problems are arising? So that table indicate the condition of the drug. That means side effect of the drug. Then but this table that indicate the cost of the drug. For that cost of that medicine, we have to select the appropriate code from Hcpcs book based on the name, dosage, and based on the route of administration, we have to select the code. So take this also. Sorry, direct code, no guidelines here. Based on the name of the product, name of the drug, we have to select the appropriate code. That's it. Is there any doubt in Hcpcs?
In exam, how many questions they ask?
3.
Hcpcs now?
3.
Okay.
Okay.
Ma'am?
Yes.
Ma'am, you said for some supplies can be given for Medicare and Medicaid. That differentiation is there, right? In the book itself, it would be mentioned or not? Or
No, not mentioned.
Have it in
Because not mentioned, because that is purely based on the client specification. Okay, that is purely based on the client specification. So here that's a right question, because some of the drugs are not valid for Medicare patient. Okay, that drugs are only valid for a Medicaid patient. But as per our general coding guidelines, there is no variation for drugs, Medicare and Medicaid. Okay, but a supplementary is differ. So usually HIPEX codes is reported for both Medicare and Medicaid patient based on our general coding guidelines. But it will differ based on the project, based on the payer. It will differ. Some of the payer accept a particular medicine for a Medicare patient. Some of the payers means insurance company. Some of the payers does not accept that medicine for that Medicare patient. So that is purely depends on the payer guidelines. As per our general coding guidelines, we can apply the code for all of the patient. Did you understand now? Do you understand? Oh. So now I am going to take billing. I can able to share this billing PDF first. Okay. So here, billing, compliance under regulatory, total guys. I will. This is 5 marks. This is our old question pattern. Based on our old question pattern, we have a 5 mark. Now we have a 3 marks only. I will share the corresponding question pattern in our WhatsApp group. I will share. So compliance under regulatory. So in that compliance under regulatory, we are going to discuss about billing concept. What is the meaning of billing? So in this billing section, we are going to discuss about a very important concept only. So in that PDF, we are providing the general information also. But in this session, we are going to discuss about the very important topics on billing. Okay. So billing, what is the meaning of billing? So billing is a process of submitting the healthcare provider document and follow the claim, and they are help the provider to receive the payment from the insurance company. Billing is a process submitting and following the claim. Why? To receive the payment from the insurance company. So we are working for doctors. So in billing section, they are submitting the doctor's report and following the claims, and to receive the payment from the payment from the payer. So we are working for provider to get the payment from the insurance company. Okay, so that is the process of medical billing. See that this is the exact definition: submitting and following an claim with the healthcare companies, insurance company, in order to receive the payment of service rendered by the healthcare provider. Suppose if a doctor take X-ray, means once the coder has been submit the document, means that the document has been transferred to the billing section. So that billing section fixing the appropriate dollar values and submit to the insurance company. The insurance company process the claim and give the amount for the provider. Okay. So that's it. So that is the meaning of billing. Now, it's just a definition. I am going to explain you detailing about the RCM, Revenue Cycle Management here. Before that, so what are the information we want to know? I think everybody know that patient who receive the service, who receive the treatment from the provider. That person is a patient. Provider is nothing but is a doctor. Then payer is the insurance company. Insurance company is a payer. Insured means who cover under the policy. That means a person who is covered by the insurance, means that persons are called as insured. Insurer is the insurance company. Owner of the policy is subscriber or policy holder. For example, if I am getting the policy from any insurance company, means I am the owner of the policy. My family members comes under that policy. So actually, I am getting a policies from an insurance company. So I am the owner of the policy. So that insurance will cover my family members also. So my family members are dependent. I am a owner of that policy. Who all are covered under the insurance service? They are called as insured. Who all are covered under the insurance service? So they are called as insured. Then insurer means insurance company. Did you understand these four terms? Policy holder, dependent, insured, insurer.
Yes, sir.
Okay. Then participating provider means a provider who has a contract with an insurance company, because the insurance company will give a payment only for that provider. Because that provider taking a contract with that insurance company, that provider is called as participating provider. Non-participating provider means a provider who does not have a contract with the insurance company. So for that provider, that insurance company will not give a payment. Because that provider not contracting with that particular company, insurance company. So that's why they are not ready to pay the payment for that provider. They are not their client. Okay. So who have a contract with that insurance company, that providers are called as participating provider. Then client is the customer. Subclient is our client. So client is the customer. So here doctor is the customer. Then for example, MNC are directly buy the project from the provider. So here the customer is the doctor for that MNC company. Okay, customer is the doctor. Doctor is the customer for that MNC company. For example, Omega Healthcare, VTech, okay, Coro Health, Global Health. So these are the medical healthcare companies. For these companies, a particular doctors are providing their project, providing their chart. So doctors are customer. Then MNC is a client. Client is a customer. Subclient is our client. So suppose if an MNC will give a project for any startup company, means that is a client. Okay, client is the customer. Customer is a doctor. Subclient means our client's client. Like our client's client, or like suppose, for example, a doctor give the project for V technology. So who is the customer for V technology? Who is the customer? Doctor. So doctor is the customer for V technology. Now V technology give the project for any other startup company, means so for that startup company, VTech is the customer, doctor is the customer of customer. That means our client is client. Did you understand now? Did you understand?
Yes, ma'am. Yes, ma'am.
So doctor is a customer, VTech is the so doctor is a customer, and for a VTech, the doctor is a customer. Then now VTechs give the project for startup company. So for that startup company, VTech is the customer, doctor is the client's client. Client's client. That is sub-client. Okay. Then this is called as revenue cycle management. In our Indian healthcare system, if we have any problem, means we can able to directly meet the doctor, and once we got the service, we should give the amount directly for the providers. So here, who give a amount for the provider? Patient will give a amount for the provider. For this is our Indian healthcare system, but in our US healthcare system, that means the patient does not give the payment directly for the provider. So provider claim their service, then insurance company will only give the amount. Here patient does not give the amount directly for the provider. So here patient pays some amount for the insurance company. Payer is the insurance company. Am I right? Payer is the insurance company. Patient pay on monthly basis or yearly basis, pay some amount for insurance company. That is called as premium amount. Based on that premium amount, the payer, that means the insurance company, will give some coverage for the patient. Coverage means based on that amount, they will pay for some surgery procedure, will pay for some surgical procedure, pay for medicine, like that. So based on that amount, insurance company will give a coverage for that patient. That is insurance coverage. Then here, if a patient has any problem, means patient go to meet the doctor after completion of the during that visit, the patient must provide their insurance detail. So based on that insurance detail, doctor will claim the service. Doctor will claim the service with the payer. Payer will give the amount for the provider. Here, patient does not give the amount directly for the provider. So this is called as revenue cycle management. So this is the simplest process. Actually, this is the entire process. So this cycle is called as medical billing cycle, revenue cycle management. Now, before going to meet the doctor, patient in that doctor's front office, they give some chart, demographic sheet. Okay, so before going to meet the doctor, patient must fill some details in demographic sheet. So the demographic sheet is provided in doctor's front office. So in that physician front office, they are giving a demographic sheet. Once the patient has filled the particular detail, means patient can able to meet the doctor. Patient can able to meet the doctor. What are the details that are present in demographic sheet? Means see that. This is a sample demographic sheet. This is a sample demographic sheet. In that sheet, patient name, first name, last name, text format. Converting the doctor's voice report into text format. That is the role of transcription department. After that text report has been transferred to the coding department. Here is our role. Here, every medical coder want to report the appropriate CPT, ICD, Hcpcs and modifiers. So in medical coding, they have to convert the doctor's text into alphanumeric format. That is our role. After completion of coding process, that chart is called as charge sheet. Because here we are converting the text report into alphanumeric format. So that document is now called as charge sheet. In that charge sheet that contain name of the provider, patient name, insurance detail, CPT, ICD codes, Hcpcs. So every information that are present in charge sheet. Every information that are present in charge sheet. So that charge sheet has transferred to the billing department. In billing department, they are scanning and all of the informations are stored in billing server and scanning the document and FTP means file transfer protocol. After scanning the document, that documents are processed at the site of file transfer protocol. In that billing office, coding of India and the billing office, they are allocating the particular dollar value for CPT and ICD codes. Based on that CPT and ICD, in billing office and coding of India, they are fixing the particular dollar value. So that charge sheet now converted to the charge entry. In charge sheet, we have a CPT code, ICD code, modifiers, Hcpcs. But in charge entry, along with these information, the corresponding dollars value also present in that charge sheet. So billing section only know about the exact dollar value of each CPT and ICD. Coders do not know that. Coders don't have an idea regarding of that dollar value. So billing section only know the dollar value of each ICD and CPT. So in charge entry that contain the particular information along with the dollar value. Then that charge entry has been transferred to the clearing house. After fixing of the dollar value, the billing office transfer the charge entry into the clearing house. Clearing house is nothing but clearing house is a middleman between the provider and the insurance company. Because we are working for provider, am I right? So clearing house is a middleman. It's an agent between the provider and the insurance company. So in clearing house also, they are just verifying the details and that document that claim has been submitted to the insurance company. In that, cash posting is nothing but they are fixing the account detail of that provider. That's it. Account detail and then corresponding amount has been fixed in that provider document. Because insurance company want to transfer the amount means insurance company wants the account detail of that provider. Am I right? So account information that are present in cash posting. And after once the client has been reached the insurance company means they are starting the process of adjudication. Adjudication is nothing but they are verifying the document. They are verifying the CPT code, ICD codes, Hcpcs code, modifiers, and the coverages comes under the service or not. The services cover under the coverage or not. Every informations are verified by insurance company. That process is called as adjudication. After that, they are giving a EOB, explanation of benefit. So after verification process, they are giving the explanation of benefit for provider. Explanation of benefit. Actually, explanation of benefit means nothing but in that explanation of benefit, they are clearly denote the detail. What is the CPT error? What is the IC? Is there any CPT error, ICD error, or cover a service not cover under the policy? What are the that means, for example, what is the cost of the surgery? How much we want to give extra? So every information that are present in EOB. So in explanation of benefit, that is called as EOB. In EOB, they are giving the detail of coverage information, cost of the service, what is the actual cost of the service, how much the insurance company will pay, how much we want to pay. So every information that are present in EOB. If there are any errors is present means they are denial the chart, denial the claim. Denial means reject the claim. If there are any CPT error, ICD error, if there is missing of insurance details, service not cover under the policy means they are rejecting the claims. They are rejecting the claims. That is called as denials. Suppose without any error, that claims are called as clean claim. Without any error, service is also covered under the policy. So without any error, that claims are called as clean claim. So clean claims will get a payment at first time. Then copy of the payment, receipt of the payment will send for the provider and the insurance and the billing section. Okay. So the copy of that receipt, has been transferred to the provider as well as transferred to the billing office. Did you understand that meaning of denial, adjudication, and clearinghouse? Any doubt?
Repeat the adjudication once.
Adjudication is nothing but once the clearinghouse submit the document means in that insurance company side, they will examine, they are verifying the CPT codes. If the CPT codes is matched with the procedure, so they are verifying that, they are auditing the claims. That is called as adjudication. They are auditing the CPT codes, ICD codes, Hcpcs, and they are auditing that the coverage services cover under the policy. So for example, if a patient take take the skin surgery, that means cosmetic surgery. So usually cosmetic surgery most probably does not cover by the insurance company. So that is service not cover under the policy. And sometimes they are giving the actual cost of the service. And so for example, if a patient take 5 lakh policy only, but the cost of the service is 6 lakh means the remaining 1 lakh we want to pay. So every informations are auditing by the insurance company. That is PDF for you. Okay, I will share you. I have a permission to share this. Did you understand? EOB, explanation of benefit. All of the informations are filled in the single sheet. Okay, that is EOB, explanation of benefit. So if there are any ICD CPD error means that chart again transferred to the coding department for recoding. So once the document has been rejected means in billing office they are checking what is the reason for that rejection. What is the reason for that rejection? So if there are any CPD error, ICD error means that chart has been transferred to the coding department. And again they are coding the chart and again the process has been continued. So suppose there is no error, but they are rejecting the chart. There is no error. Service also cover under the policy. No CPT error, no ICD error, there is no error. But the insurance company denied the chart. So in that case, that type of claims are transferred to the AR department. account receivable. AR means account. I think everybody know that AR column. AR column, account receivable. So without any ICD error, CPT error, and service also cover under the policy, but the insurance company denied the charge. So that type of charge has been transferred to the AR caller. AR caller communicating with the insurance company and what is the reason for that rejection. So everything should analyze. They are trying to convince the insurance company and get the payment for the provider. So they are discussing with that rejection. What is the reason for that rejection? There is no error, but why they are rejecting that? So every detail has been collected by AR caller. AR caller, they are communicating with that insurance company and convince them to give the payment for the provider. So that is the process of revenue cycle management. Did you understand? Any doubt? Any question? Doctors do not have a convenient time. Doctors want to meet nearly 20 or nearly 10 patients per day. Okay, it is not possible to make a text document for each and every patient. So that's why here comparing with the preparation of text document, voice document is that take a very less time only. Am I right? So that's why doctor give.
Okay, ma'am.
Now I am going to explain about. So we are going to discuss about the important thing only. Okay. So no need to read. For your general information, we are providing the documentation for all of you. But for important information is necessary for CPC exam also. No need to read the entire thing. Insurance. There are two types of insurance. This process is not followed in our country. We are discussing for another countries, US healthcare. So there are two types of insurance: federal insurance, non-federal insurance. Federal insurance means that is governmental insurance. Non-federal insurance is private insurance. Actually, this PDF for billing student, billing section training students only. Okay, so the same PDF we will provide you guys for your additional information only. No need to, because there are 95 pages are here. No need to read the entire pages. If you are going to take CPC exam also, no need to read the entire thing. We are giving the complete detail of billing. Okay, but no need to read the entire thing. So we just want to focusing on the important thing only. So for federal insurance, Medicare, Medicaid, CHAMPA. So these are the insurance governmental insurance policy. Medicare, Medicaid, CHAMPA. So these are the governmental insurance program. That means insurance policies. And for federal means the PCBS, ATINA, WC. These are the example for non-federal government. Non-federal insurance. Now we are going to discuss about Medicare, Medicaid one by one. Medicare means what is the eligibility of Medicare? Medicare is one of the insurance program, federal insurance program. So who all are covered under this policy means 65-year-old, disabled people, ESRD people, they are covered under the policy of Medicare. Okay, here HIPAA, last one. Health Insurance Portability and Accountability Act, that act is from 1996. This act, we have an act from 1996. What is this? What is the usage of this act? HIPAA means every patient information has been keeping very confidential, very confidential. We can't able to discuss with others. So every patient health informations are very confidential. We do not have an authority to share with our friends also, with our family members also. So we can't able to discuss their health information. Suppose if you are coding, patient get the outpatient service from the hospital. Patient get the service from the provider in hospital. But in part B, outpatient service, outpatient means for a particular clinic of that provider. So if I am going to meet a doctor in the hospital, but I am going to meet in OP service only, I am going to get OP service only. Okay, I am going to get outpatient service only, but that outpatient service I am going to get in hospital. So at the time that will cover under the policy of A. Policy B for individual clinic of that provider. If a provider has a own clinic means, if I am going to get the service from that provider's individual clinic means that comes under part B. Did you understand the difference of part A, part B?
Yeah, ma'am.
Then part C, it's also called as Medicare Advantage. If a patient who have a part A and part B means that patient is eligible to switch over the part C. That means if a patient who have a part A and part B means that patient can able to take part C. So what is the usage of part C? What are the services that are not covered under part A and part B means that type of service are covered under part C. So for example, some of the services are not covered under part A and part B. So that type of service are covered under part C. Okay, for example, okay. So for example, skin replacement surgery not. Guys, this is for example for your understanding purpose only, because this service also covered under the policy A. Okay, so that's why. So if, for example, if a patient got a skin replacement surgery, so that surgery is, suppose if that surgery is not covered under part A and part B means part B will cover that surgery. Okay, if a skin replacement surgery is not covered under the policy of A and B, so in that case, that type of service is covered under part C. So that give advantages of, that give extra advantages, that is called as Medicare Part C. Did you understand now? Did you understand?
Yeah.
Then part D for prescription drug only. If a patient who have a part D means that patient can able to claim for their medicines. So medicines, most probably in our country we want to spend maximum amount for prescription medicines. So if a patient who have a Part D means that patient can able to claim for their medicines also. That is prescription drug benefit. For the cost of the medicine, we can able to claim from the part D. And Medicaid. Then, Medicaid. Medicaid means it serves for low income people. Medicaid, it serves for low income people. That means who all are covered under the below poverty line. Who all are comes under the below poverty line means that they are comes under the policy of Medicaid. So what are the eligibility? Below poverty line people, low income people, blind age people, but who's 65-year-old must present in 65-year-old patient. Blind people, but the patient age must be 65 years and older. Disabled people, widow or widowers, whose age is 50 to 65, whose ages must be 50 to 65. And the last point is aid families with the dependent children. That means children who have lived in orphanage. Orphan children comes under this Medicaid. Okay, so if children who all are live in orphanage means they are considered as orphan children. Am I right? So they are comes under the policy of Medicaid. So these are the eligibility. Of Medicaid. Okay. In your examination or in your interview, they definitely will ask regarding of that eligibility. For medical coders, they do not ask the question from billing, but this is a basic information. Every medical coder must know about Medicare and Medicaid policy. But the rest of the what is the meaning of transcription department? What is that? The rest of the things is not necessary for our medical coders. But every medical coders must know about the federal insurance policy. Medicare, Medicaid, CHAMPAS. These are the Medicare, these are the federal insurance policies. Am I right? Everybody must want to know about it. So you can, in your interview, they definitely will ask the question from this section. Then CHAMPAS. Civilian Health and Medical Program of Uniformed Service. Civilian Health and the Medical Program of Uniformed Service. It's also called a striker service. What is the meaning of that? That means a person who have worked in military, or retired from the service or active in the military, they are covered under this policy of CHAMPAS. A member who retire from that service or active in duty, whatever it is, a person who have work in military, if for militarians, all are covered under this policy of CHAMPAS. Did you understand the concept of CHAMPAS? Did you understand the concept of CHAMPAS?
Yes,
CHAMPA means Civilian Health and Medical. Guys, abbreviation is very, very important, guys. CHAMPAS, abbreviation is very, very important. Civilian Health Medical Program of Department of Veterans Affairs. So this is a full form of CHAMPA. So here, these insurance program will cover their veterans. Veterans is also the one of the army man, soldiers. Veterans means soldiers. So for this CHAMPA, what are the eligibility of CHAMPA means? There are two conditions. Condition number 1, veterans who has a 100% disabled during the service. Actually, CHAMPA will cover their family members also. Not only for the veterans, it also cover for their family members. But in CHAMPAs, it does not cover their family members. The insurance program CHAMPAs that covers the service only for militarians. It does not cover their family members. So if the insurance want to cover their family members means that will comes under CHAMPA. So CHAMPA will cover their family members. Okay, CHAMPA will cover their family members. For that we have two eligibilities, two conditions. Condition their family members and then veterans. This insurance program will cover their family members and then veterans. Condition number 2, suppose if a veteran who died from the service, means this insurance program will cover their family members. CHAMPA only cover their family members, not only for veterans, it also cover their family members. But we have a two condition. Condition number 1, veterans who has 100% disabled during the service. So at that time, the service will cover their family members and then veterans also. Condition number 2, veterans who died from the service means this insurance program will cover their family members. That's it. Did you understand? Did you understand these 4 federal insurance program?
Yes, ma'am.
Then I think everybody know that Medigap. Medigap means to fill the gap. So as I told you already, so for example, if a patient just take the policy for 5 lakh, but the cost of services, but the cost of the procedure is 6 lakh. So the remaining 1 lakh patient want to pay from their packet. That is called as out of packet. So actually, patient just take a policy for 5 lakh, but the cost of service is 6 lakh. Then the remaining 1 lakh patient want to pay. So that is called as out of packet. In that case, suppose if a patient has another policy from the private insurance company, means private insurance company will give a remaining 1 lakh. So that is fill the gap. So suppose if a patient has a insurance policy from private insurance, means that the private insurance company will pay the remaining 1 lakh for that patient. That is called as Medigap. Fill the gap. Worker compensation, I think everybody know that ESI. ESI means that is on a monthly basis, they are deducting some amount from our salary. So they are offering a card, a medical card also for us. So by using of that card, you can able to get the medical service freely from the government hospital. So like that, coverage is provided by employees to cover employees injured during on the job. So we can able to get the service free of cost from the hospital. Then birthday rule. Birthday rule is nothing but, guys, please listen. In a family, mother and father both are having a separate insurance policy. Okay, in a family, mother and the father both are having a separate insurance policy. In that case, insurance company use one method to find out whose policy is primary. Whose policy is primary for their dependents. Example, mother and father who has a separate insurance policy. Now, mother-in-law is admitted into the hospital. Okay, mother-in-law is admitted into the hospital. So in that case, insurance company will deduct the amount from who? So to decide that they are using some method whose birthday is occur at first in the calendar year. For example, mother and the father has a separate insurance policy. Okay. So whose birthday is occur at first? For example, father born on January, mother born on February. So whose birthday occur at first? Mother or father?
Father.
Father. They are deducting the amount first from the father account. After that only they are deducting amount from mother to find out whose coverage is primary for their dependent. So for her mother-in-law, first insurance company deducting the amount from his husband account. After that only they are deducting the amount from wife. Suppose both are born on the same month, same year. Some of the students asking same time. Most of the students asking same time. So whatever it is. So in that case, they are using another method. Who got a longest method? For example, father had a plan for 5 years. Father had a plan for 5 years, but mother had a plan for 3 years. So who has a longest policy here? Mother or father?
Father.
In that case, they are deducting the amount first from the father account. So by using of that birthday rule, insurance company will deduct whose policy is primary for their dependent, whose policy is secondary. So that method is called a birthday rule. Did you understand that?
Yes, ma'am.
Yes. Very important birthday. Then I think COBRA, everybody know that COBRA, Consolidated Omnibus Budget, Consolidation, the Act, that is called as COBRA. So that is as per our federal rule, the worker can able to continue. That means the worker can able to take the service from that under the policy of ESI. Suppose up to 18 months. If they are lose their job, or coverage is otherwise terminated. So actually ESI for working people. Suppose if patient has lost their job, the patient has lost their job, that patient can able to get the service under that ESI. For our country, we are using the method ESI. I just saying the word for your understanding purpose. Okay, ESI. I just saying this word for your understanding purpose. So the patient lost their job. Okay, lose their job. So in that case, that patient can able to get the treatment under that worker compensation up to 18 months. Up to 18 months. That is called as COBRA. But the important thing is, patient must continue to pay the premium. Okay, he lose their job, but on monthly basis, patient want to pay the amount properly for that government. Then only they will get the service under the worker compensation. That is called as COBRA. Did you understand now? Understand? guys find it out? Actually, I lost my job. Okay. But up to 18 months, I can able to get the service from that worker compensation. So I lose my job, guys. So ESI, that means worker compensation for workers. Worker compensation for workers. When a patient who have injured during the job, the patient can able to get the treatment from the free of cost under the worker compensation. So, but I lose my job. But I can able to get the treatment up to 18 months. Now, I don't have a job. Still now, I can able to get the service from worker compensation up to 18 months. After 18 months, I can't be able to continue the service. Up to 18 months only, I can get the service. I can able to get the treatment from the free of cost. So for that, on monthly basis, I have to pay. I have to continue the payment. I have to continue the payment. So then only I can get the service from worker compensation. Do you understand now?
Yes, ma'am.
Then UPIN. UPIN is actually discontinued, guys. Now PIN and NPA only inactive. So PIN is nothing but provider enumeration. So before that I just explained NPA. After that I will explain UPIN. NPA means National Provider Identifier. So that means it's like our doctor's license number. After completion of training, the government will give a license number for every provider for their practice. Am I right? So NPA is a National Provider Identifier. ID number. Suppose if a doctor work in different hospital means each hospital will give a different number, different ID number. So that's why a doctor can have more than one PIN number but only one NPA number. Did you understand? Did you understand?
Yes.
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 SSN number. SSN number means National Security Number. So like our Aadhaar number. So every citizen has a SSN number, like our Aadhaar number that contain 9-digit number. First 3-digit numbers are area number. Central 2-digit numbers are group number. Final 4-digit is a serial number. First 2-digit or first 3-digit are area number. Central 2-digit number are group number. Final 4-digit numbers are serial number. Okay, that's it. Then very most important thing is fraud and abuse. Fraud and abuse. Fraud means doctor intentionally pay for the expensive service than actually performed. So doctor intentionally pay for the expensive service than actually performed. That is called as fraud. So for example, actually doctor take 3 chest x-ray only, but he claim for 5 chest x-ray. Actually doctor took a 3 chest x-ray only, 3 image only, 3 views. But he claimed for 5 views. So that's why doctor intentionally claimed for the expensive service then actually performed. That is called as fraud. Abuse means mistakenly claim for the service. Mistakenly. Yeah, this is a fraud for intentionally pay for the service. Abuse means mistakenly pay for the expensive service. That is called as abuse. Did you understand now? Did you understand, guys?
Yes, ma'am.
Okay, guys. Session is over. So we'll meet on tomorrow. Tomorrow we have a class. Okay, tomorrow we have a class. I will share the link on our WhatsApp group, and as well as I will share this medical PDF in our WhatsApp group also. Okay. Thank you, guys. Bye, guys. Bye.
Thank you.